Hi, my name's Lizzie Summers and I'm a clinical psychologist in the Clinical Health Psychology team at North Bristol NHS Trust.
And I'm Nikita Werrett. I'm an assistant psychologist in the Clinical Health Psychology team, also at the North Bristol NHS Trust.
This session we will be thinking about psychological and social well-being in lung health. This session will be particularly focusing on managing low mood and fatigue. Please also see our other video on managing anxiety if you feel like this would be helpful for you. So we're going to think about how living with a lung condition affects our psychological and social well-being, and then particularly focusing on depression, low mood and fatigue. We'll go on to think about what might help, and then finally we'll think about further sources of support should you wish to access these. The most important thing to say is one size doesn't fit all, and these are just some ideas which might be useful for you. Some parts might be more relevant than others, and that's okay. So what do people tell us about living with a lung condition? It's not uncommon for people to experience a whole range of emotions. For example, frustration, anger, sadness, loss. People might feel nervous about the future or fearful. We also sometimes see changes in people's confidence. This might affect people's confidence going out or doing challenging or new things. Sometimes people can feel quite overwhelmed, or they might feel that there are too many competing demands, attending appointments, taking medication, and dealing with other people's expectations. For some people, it might affect our mobility or energy levels, and some people might experience increased levels of fatigue. Loss can also be something that people experience, and this could be to do with loss of previously enjoyed activities, or perhaps loss in changes of role in the family. The most important thing to note is that all these experiences and feelings are completely normal. Living with a lung condition can feel difficult to manage at times. The research also tells us that people who are diagnosed with a lung condition are at increased risk of experiencing low mood and anxiety and increased risk of fatigue. It's important to note that these things all exist on a continuum, and you may experience good days and harder days. As I mentioned, this talk focuses on managing low mood and fatigue whilst living with a lung condition. Low mood and fatigue can have a big impact on our health, our quality of life, our exacerbation rates, and our number of hospital admissions.
So low mood and depression. We all know what it's like to experience low mood. Sometimes it's a direct consequence of something happening in our lives, like a bereavement. At other times, the reasons for our low mood can be difficult to pinpoint, and we may not have an obvious cause. Feeling depressed is more than just feeling down or fed up. It can sometimes feel dominant and all-consuming. That's why we talk about depression as being on a continuum. If you're feeling very low in mood, it's important to remember that there is support that you can access, and we will discuss this later on. Feeling depressed is not a sign of weakness. It's not something that you can snap out of by pulling yourself together. So, how does it make us feel? What do we do when we are low in mood? And how might we feel physically when we are low in mood? So how do we feel when we're low in mood? The obvious one is we may feel sad. We may feel hopeless, lonely, fed up. And what might we do? We might lose interest in some of the activities that we used to enjoy. We may lack motivation. We may cry. And how might we feel physically? We might end up sleeping a lot, or we may feel very tired all the time. Sometimes changes in sleep are to do with us having a busy head rather than difficulties associated living with a lung condition, such as postural difficulties or coughing more. So as we've discussed, experiencing low mood and depression can have an impact on our feelings, our behaviour and our physical body.
So what might help? There are a few key things that can help us when we're feeling low in mood or depressed. Firstly, social engagement. So this might be keeping in contact with, either by phone or virtually or in person if possible, our friends and our family. Secondly, activity planning and increasing our enjoyable activities, which we'll come on to talk about in more detail. Thirdly, exercise, so a core component of the pulmonary rehab programme. Exercise can really help with our mood. Going on to think about our sleep habits. So having a good night's sleep and ensuring that we're getting enough sleep can have a huge impact on our mood. We will have a video available on the platform specifically relating to sleep techniques. Another thing that might help is accessing support groups. So again, this could be virtually or in person, but reaching out to other people who might be in the same situation as you are. And finally, accessing further psychological support if you feel this would be of benefit to you. It can help to recognise vicious cycles that might occur when we're feeling low in mood. So when we're feeling down, low in mood or depressed, we can lack motivation and energy. This means that we might avoid things. We might avoid going out. We might avoid seeing friends. This can lead us to feeling socially isolated and alone, which can in turn increase our low mood and make us feel worse.
Something that usually helps boost our mood is planning out and carrying out activities. Try and plan an activity for the morning, the afternoon and the evening. It can be helpful if you could record how you feel when you carry out each activity. Try to include a mixture of activities with other people as well as activities that you do on your own. Sometimes it can feel difficult and we might need to push ourselves to stick to exactly what we've planned. We also need to factor in how we're feeling physically. It might mean that you need to find a balance between activities within the home and also outside of the home, depending on how you're feeling. It's useful to balance being physically active, keeping socially connected, doing chores, required tasks, as well as value-based activities that you enjoy. So here's an example week. We've put in some exercise, socialising, chores, cooking, but also rest time. You might also want to set yourself small achievable goals, like putting in some new plants in the garden. That would require you to go to the garden centre and pick up some things that you want, but then also scheduling time to plant the plant. Allowing each day to have a purpose that isn't busy and overwhelming, but also isn't empty, can really help. This doesn't have to be exact, but it's nice to have structure in your week so that you have a plan when you get up in the morning. This will look different for everyone. We don't expect your week to look exactly like this. And it's very dependent on whether you're working or you're retired. If you're working, it's important to make sure that you rest. It can be really difficult to juggle work, social life, family pressures, household chores, and rest. This might mean that you plan your week so that you schedule in rest. That might mean meal prepping on a Sunday evening so that you don't have to spend any time cooking in the week. Or it might mean getting your food shopping delivered so that you don't have to go out and get the food shop. Or we could suggest scheduling in an evening to do something that's just for you. So now this leads us on to fatigue and pacing. Pacing can play an important part in managing your condition and can allow you to keep balance and stay in control. Pacing means different things to different people at different times in their lives. It's about spacing out your activities throughout the day, doing things at a slower speed or in a different way to avoid making any symptoms you experience worse. On days when we feel well, it's tempting to do things that we weren't able to do on the days when we were too tired or felt unwell. Or it can be really easy to overdo it on these good days. This can lead us to having more symptoms or feeling more tired on the following days, so we can't do as much. So it might look a little bit like this. We feel good, we overdo it, our symptoms get worse, we rest, our symptoms improve, so we do more to catch up, and then our symptoms get worse, and so on. And you can see how we can end up in this vicious cycle. So it's important to think about planning activities, keeping socially connected, and doing things you've enjoyed like we've spoken about. However, it might be that we need to think more carefully about how we manage these activities and also not overdo things. So successful pacing involves breaking things down into chunks. You can choose not to do things all at once. So for example, we decided to go to the garden centre and plant the plants on 2 separate days, not on the same day. Slowing down, you can choose the speed that you do things. Prioritising, deciding exactly what needs to be done first. And planning, deciding what to do and how best to do it.
So what else might help when we're feeling low in mood or fatigued? There are a few key things: acceptance, self-compassion, and knowing when to access further support. So firstly, thinking about acceptance. There are lots of things in life we can't control. In fact, all we can control is ourselves right now in this very moment. We can't control what happens in 5 minutes or 5 hours. We might be able to influence what happens, but ultimately, all we can control is this very moment. If we can work on accepting how we feel right now and accept what's happening right now, this can bring quite a lot of relief to our life. Often when we're anxious or low, we spend a lot of time thinking about things that have happened in the past or things that might happen in the future. And this can make us feel more low. These are things that we can't control. The idea of acceptance isn't about giving up or feeling defeated. But sometimes we need to make space for difficult feelings and know that emotions and feelings come and go. If we spend a lot of time struggling with thoughts and sensations and feelings, we're likely to end up feeling more unhappy. Another component that can help when we're feeling low in mood is self-compassion. Ask yourself, how do I talk to myself? Am I self-compassionate or am I self-critical? Often we are our own biggest critics. Often we wouldn't say the things that we say to ourselves to a close friend or loved one. We often give ourselves quite a hard time about things that we perhaps can't do as well as we used to, or things we haven't achieved in the day. We rarely would say the same things to people that we care about. It can be helpful to start to notice your inner critic, and any time you find yourself being hard on yourself, just check in and ask, would I say this to someone I care about? If we're constantly putting ourselves down all the time, it's likely to have a significant impact on our mood, our self-esteem and our confidence. And finally, obviously this is a short presentation and we can't cover everything, and there are other avenues of support should you feel you would like to access these. So as usual, if you have any concerns relating to your physical health, it's advisable that you contact your GP or your respiratory team. If you have concerns relating to your general mental health, so perhaps experiencing low mood and anxiety that's not related to your physical health condition, then again you could discuss this with your GP, or you could access Vitaminds, part of the Vita Health group, and the website is available on the screen. Vitaminds also provide a range of different support on their website. And finally, if you notice that you're struggling particularly with your feelings relating to your physical health problem, then the best thing to do is talk to your pulmonary rehab team, or if you are under a consultant, then discuss that with them, and they can direct you to the most appropriate source of support. We hope you found this video helpful, and please remember there are other videos available on the platform should you wish to access these. Thank you.
Thank you.